Risk factors for coronary artery disease include a diet high in saturated fats, sedentary lifestyle, depression and anxiety, obesity, smoking. People who smoke have a significantly higher risk of heart disease, including coronary artery disease. Age. As a person gets older, the heart undergoes subtle physiological changes that will increase that person's risk of getting coronary artery disease. Race. African descent. Among persons with coronary artery disease, the cardiovascular death rate for African Americans is reported to be particularly high. Symptoms for coronary artery disease are hypertension, angina, fatigue, and palpitations.
Now for the normal physiology. Coronary arteries are the blood vessels that supply blood and nutrients to the myocardium, more commonly known as your heart muscle. From the aorta, the blood vessels split into the left and the right coronary arteries to supply each respective side of the heart. The oxygenated blood from the heart drains to the cardiac veins, into the coronary sinus, and into the right atria. Going into the cellular level, a person's blood will be composed of erythrocytes, leukocytes, and lipoproteins, where the amount is determined by an individual's diet. Leukocytes and lipoproteins, along with the body's inflammatory response, plays a key role in developing coronary artery disease. The coronary arteries are the only source of oxygen and nutrients to the heart, which is why they are very important in bodily functions and in homeostatic maintenance. And now for the pathophysiology.
When there is cell damage to the endothelium, adhesive molecules are released to attract leukocytes. Leukocytes adhere to the endothelium. They start secreting cytokines, which start the inflammatory response, along with communicating with the smooth muscle cells of the tunica media. The smooth muscle cells actually start entering the intima in response to these cytokines and actually start proliferating and start creating their own complex extracellular matrix. The extracellular matrix of the smooth muscle cells have proteoglycans attached to them. And these proteoglycans behave as kind of links to bind lipoproteins in the blood. This response actually propagates and prolongs the inflammatory response that is contributing to the formation of plaque. The macrophages that are stuck in the plaque commit apoptosis, and the death of these macrophages results in the lipids contained in them to be deposited into the plaque deposits. These plaque deposits cause tissue factor to be released, which starts beginning the clotting response.
This demonstrates the blood flow in the coronary artery. If hard plaque builds up in the arteries, the blood flow slows down, preventing enough oxygen from getting to the heart.
When the coronary arteries that supply the heart with blood, oxygen, and nutrients become damaged or diseased, the myocardium becomes hypoxic, and this is often associated with chest pain or angina. This is when you feel pressure or tightness in your chest. Other symptoms are fatigue, hypertension, and palpitation. And now to relate the key concepts to coronary artery disease.
With the cell membrane, the proteoglycans of the extracellular matrix of the smooth muscle cells are adhering the lipoproteins in the blood.
With homeostasis, improper balance of lipoproteins in the blood, particularly low-density lipoproteins, contributes to the formation of plaque. As a result, the normal blood flow is disrupted, reducing the amount of oxygen that gets to the heart.
Proteins, the protein component of the lipoproteins and cytokines inflammatory signal, plays a key role in the plaque formation.
To summarize, coronary artery disease is the narrowing of the blood vessels that supply blood to the heart. This narrowing of the blood vessels is caused by plaque buildup due to prolonged inflammatory response involving lipoproteins.